And we are all over breaking news right now at 5 o'clock. Governor Eric Holcomb in quarantine after several members of his security detail have tested positive for COVID-19. Indiana State Health Commissioner Dr. Christina Box advised the governor and First Lady to quarantine beginning today. They will be tested later this week. The State Department of Health will perform contact tracing. Dr. Box and Dr. Lindsay Weaver will lead tomorrow's weekly COVID-19 briefing, and the governor will join them by the phone. We'll keep it posted if anything changes on this one. Big breaking news here on this Tuesday.
Hospitals in central Indiana are being overwhelmed by the rising number of coronavirus cases.
Hospital staffs have been decimated by the virus, and IT Mate's Richard Essex is told that many hospitals are near a breaking point. Richard.
The Indiana Hospital Association is sounding the alarm. COVID-19 hospitalizations are at a record number. The number of people on ventilators is also increasing every day, and PPEs are starting to become in a short supply, and hospital staffs are being hit by a record number of positive cases. I talked to Dr. Christopher Dorian, the medical director at Franciscan Hospital here in Indianapolis. He told me that their supply of PPE is starting to tighten up, and they are doing everything they can to make sure that it lasts. Franciscan has experienced a six-fold increase in COVID-19 patients in the last month and a half. 5% of their medical staff is either out on quarantine or sick with the virus. Now, 5% may not sound like a huge number, but they, like a lot of other facilities, don't have a ready reserve of people standing by. The Indiana Hospital Association told IT Mate that hospitals in northern and southern part of the state are being hit the hardest right now. Many hospitals are at capacity and are forced to send patients away. Staffing remains the #1 issue at all Indiana hospitals, and some hospitals are considering using medical staff that are asymptomatic to treat COVID-19 patients.
The CDC says that is something we should consider in a crisis, and I think we are nearing, if not in that crisis. But that does require, even with COVID patients, you've got to have a lot of PPE. It takes additional cleaning of those sites.
There are not any hospitals currently here in Indiana using asymptomatic medical staff to treat COVID-19 patients, but if staffing crisis continues, it could be something that hospitals will have to consider down the road. Now, hospitals are also anticipating this current surge to last at least several more weeks. In Indianapolis, Richard Essex, Wish TV, wishtv.com, and follow us on Facebook.
All right, Richard, thank you very much. Well, the state health department is reporting 2,951 people have been hospitalized for COVID-19. The department is also reporting 5,500 new positive cases in the state, meaning there have been more than 262,000 cases here in the state of Indiana. The report also adds 84 deaths. They happened between October 22nd and November 16th. More than 4,700 people have died since the state began tracking the pandemic numbers.
Expect changes to upcoming legislative session at the State House.
Yeah, lawmakers discussing the new measures today during Organization Day. News 8's David Williams talked with lawmakers about their plans during the pandemic.
Built in 1888, Indiana's State House has seen history come and go, but an Organization Day during a coronavirus pandemic is uncharted territory for these state lawmakers.
We have to be careful. We have to practice safe distancing so that we don't spread if we are affected.
Around the State House, you'll find hand sanitizers, plexiglass dividers in both the House and Senate chambers.
We're going to be very cautious, very cautious, because we don't want to have an incident here.
And signs requiring masks to be worn inside. But state lawmakers are not required to wear a mask inside.
Certainly all the state employees are required to do that, but yet the legislators are not. And I don't understand that. We are the elected state leaders of Indiana, but yet we can't lead by example.
State Rep Matt Lehman chairs the committee that plans the upcoming session. I asked why state lawmakers aren't required to mask up.
We have the ability to, while in the chamber, to set some rules and encourage strongly they wear masks. But once they're outside of here, when they're in the building, they're really on their own. And so it is a little bit of a difficult needle to thread. But again, we've asked our members to be considerate, be respectful, and ask them to, while they're here, especially today, and I think even going into session, that they wear masks.
Today in the House chamber, all but one rep that I saw with my own eyes wore a mask. Everyone sat socially distanced, and that distance will be even farther apart for House and Senate members when the session starts. Lehman says while the Senate will be at the State House, House members will be in a different location.
but we feel like when it comes session time in January, we will be over at the Government Center with great hopes of before the end of session being able to move back into our chamber.
The 2021 session is scheduled to begin January 4th at the State House. I'm David Williams, Wish TV, wishtv.com, and follow us on Facebook.